I'm Lisa Patel. I am a pediatrician that is based out of California. I'm also the executive director for the Medical Society Consortium on Climate and Health. We bring together all the major medical societies, so about 60 medical societies representing 1 million physicians around the country who recognize climate change as a profound threat to our health and to health equity. My journey has been very long. I actually started off in environmental science before I became a doctor. But I think one of the moments where I really realized that I needed to drop everything I was doing and work on this issue was seeing the youth protests that really picked up in 2018 and 2019. At that point, I had become a mother, and I was just thinking to myself, we failed if kids have to protest for a livable future for themselves and can't just be kids. And it especially hit home both because I was a mom and because I was a pediatrician. And that was a big wake up call for me that I needed to do everything I could. When I started the work, the very first group of people I was working with was a group of women. And so I met a couple of other physicians that worked here in the Bay Area. All of us were physicians, all of us were mothers to young children. And we'd also had another wake-up call here because we'd had terrible wildfires in both 2018 and 2020. And I think one of the most incredible things about working with other women leaders is the sense of community and connectedness that I think is really part and parcel to how we work. Before, in my prior lives, of which I've had many, I worked for a microfinance organization where we were helping to provide microloans to female heads of household. And there's just so much data and literature that shows that when you improve a girl or a woman's life, it actually improves the lives of so many others within the communities where they live, because women spread those benefits out to the community at large. It isn't just about themselves, they uplift everyone around them. And I've certainly found that in my work in terms of working in communities of women, and why I think we need more women leaders in the space. When I had my kids, I was doing it for them. And now that they're older, they are my support in a way. My son has been instructed he has to come in every morning and give mama a big hug. We call it the power hug, where he gives me all of his power so that I can go out and help other people as well. And it's just been a nice evolution in our relationship where it's not just me taking care of them, but they're helping to take care of me too. And they are the reason why I get out of bed every single day, and who they represent, right? I don't just do this for my kids. Frankly, I understand that my kids have an incredible amount of privilege. I do this because there are so many kids who deserve fierce advocates, and often the structures that we set up mean that parents can't be the same advocates for their children because they're just struggling to put food on the table. And so I derive inspiration from, I look at my kids and look at them as a symbol for all kids and what my duty is for all of them to make sure that we have a world that I can leave them that I feel proud of.